I'm the Deputy Executive Director of the DC Health Benefit Exchange Authority. You may know us as DC HealthLink, and you're about to know us as the Healthy DC Plan.
We were selected by the mayor to implement the Healthy DC Plan for the District of Columbia. We are working with our federal partners at CMS, and we're currently waiting for federal approval to implement the basic health plan. And here in DC, we call it Healthy DC Plan. You have to be a DC resident, first of all. You have to be under 65. You cannot have an offer of affordable employer-based coverage, and you also can't have other comprehensive health insurance coverage to qualify. Undocumented residents are not eligible.
Significant changes to the Medicaid program that will be coming up mostly next year. We're going to have work requirements for some adults in order to be eligible and have your Medicaid coverage. That's a new federal requirement. Also, for a group of adults, some adults will have to have their Medicaid eligibility checked more frequently, so every 6 months instead of annually. And there will be some more changes, but those are really significant ones in terms of the Medicaid program. In Medicaid, we always say there's like 3 ways you can impact the cost of the program. It's who you cover, what services you cover, and what you pay the providers that provide those services.
If you are a single adult and you are in a household of one person, yourself, if you are making about $1,800 a month, today in DC Medicaid, you will qualify for Medicaid. So free healthcare coverage, no cost to you. You get all the benefits available to folks under the Medicaid state plan. Effective January 1, individuals making roughly that $1,800 amount or above would no longer be eligible for DC Medicaid. That's the change we're talking about here. 2 adults in the house, maybe mom, maybe dad, 2 kids, maybe an 8-year-old and a 7-year-old. If jointly your household is making about $3,700 a month, today you are eligible for Medicaid. After January 1st, 2026, you will no longer be eligible for DC Medicaid. We sent a notice out to the roughly 25,000 folks who we think will be impacted by this change, letting them know, hey, at the end of the year, you will likely be transitioning from coverage under DC Medicaid to coverage provided by DC HBX, whether that's the basic health plan or the qualified health plans.
So, you're eligible for a Healthy DC Plan if you have a household of 1. If my income falls between $21,597 and doesn't exceed $31,300, I qualify. The only people who will be eligible for lower premiums through DC HealthLink, as well as the Healthy DC Plan, are people who have green cards, are Cuban Haitian refugees, or from a current or former U.S. territory like Guam.
As Mila said, we have some good news about Healthy DC Plan. I think one of the most important things is that there will be no cost to enrollees for Healthy DC Plan. No monthly premiums and no out-of-pocket costs for covered care from participating providers. So this is similar to Medicaid, right? They will have no out-of-pocket costs. Also, hospitals participating in the Medicaid program will also participate in the Healthy DC Plan. So a lot of the providers that these folks are used to going to under Medicaid, they'll still be able to get their care when they're in Healthy DC Plan. Healthy DC Plan will have the same open enrollment as for our qualified health plans in DC HealthLink. So November 1st through January 31st. Also, for those who are losing Medicaid and will be becoming eligible for the Healthy DC Plan, they will be automatically enrolled.
The parent, head of household, loses Medicaid. The minor children will still have their Medicaid, especially those who have the HCSN. Is that correct?
Kids can still be eligible for Medicaid. In fact, we have households today where the kids have Medicaid and the parents don't because we have different requirements. So with these changes, same thing. The parents may shift to basic health plan, but their children will be okay.
Would your organization be able to come, like have a representative to come to our organization?
Yes, so we've done a lot of outreach already. We would love to be invited to any community meetings you're hosting or you're at. And we're happy to speak for 2 minutes or an hour.
How often is the MMIS system reviewed for each person that applied?
It's nightly. So the transactions go, well, I'm talking about transactions, but essentially the information goes from our eligibility system to our provider payment system nightly. So if it doesn't go the next day, it'll go either 2 days later, or if you're not seeing it within 3 days, reach out to us. We can re-trigger that information and go over to MMIS.
We're running eligibility to make, based on the data we're getting from Medicaid, to make sure that we automatically enroll residents who are truly eligible for Healthy DC Plan. In addition, DC Medicaid is running eligibility to make sure that they don't transition to us, people who really should stay in Medicaid, based on current information that all of us have on the resident and their family.
We want to thank you for joining today to learn about this. We know you have questions. We know you're going to hear about this and you're going to want to hear about this again. Take those questions outside to the tables. We have folks out there to help answer questions, and we will continue to have community events into the future.